Okay, so stereo acuity is a measure of the smallest difference in depth within a target or between targets that a person can detect. So during the Frisbee stereo test, we are measuring that stereo acuity by seeing the individual's ability to see depth differences better than the smallest depth difference that another stereo acuity test would determine, like the RANDOT test we use in clinic. So the way this works is that each stereo plate has 4 blocks on it, and this one is 0.15 centimeters thick, and each block has a different depth plane, or one of them has a different depth plane than the others, which makes it easier to stand out. And so the person presenting the stimuli knows which one based on this. There's a little knob that they can feel. And so we know that the box down in this corner has the different depth perception. So the observer will be standing at different distances, which include 25 centimeters, 50 centimeters, 1 meter, 1.5 meters, 2 meters, 2.5 meters, 3 meters, 3.5 meters, and 4 meters. And there are 10 trials done at each distance. So the observer basically just states which box the items are popping out in. Okay, so here you can see we have our plate held against the white background, which helps our patient be able to see it better. And I'm going to turn it in between each trial, and when I'm turning it, I'll have the patient close her eyes so she cannot see which direction the stimulus is coming out. So we're going ahead and going to do an example at 1 meter away. So right here, and having our patient sitting exactly 1 meter. So I'll have you go ahead and close your eyes. Okay, now open them and let me know which one it's popping out in.
Top right.
Okay, so it's important to know that this is the patient's top right and not mine. Okay, great. Go ahead and close your eyes again. Okay.
Top left.
Great job. Close your eyes.
It's not surprising for me though.
Okay.
I have really bright eyes. Yeah. Bottom right.
Good job. All right.
Bottom left.
Great job.
Get close to that.
Open.
But you know what though? I have so much light top left now.
Good
My
job.
glasses on. Yeah.
And open.
Bottom left.
Open.
Top right. I don't know if I do this
Job.
like centimeter.
Open.
Bottom right.
And open.
Top left.
Great job. Okay, so during that, we did that for 10 trials, and we had our videographer record our results.
Using the 9 trials that we did with Stephanie, our observer, we were able to get a percentage for the amount that she got correct, depending on the distance, which is charted here, and percentage charted here. Using the information that we had before, we are able to plot a psychometric function graph with our correct percentages put on our y-axis, and then our distance from which the test was taken at, our trials, on the x-axis. We then plotted these in order to find our threshold. We know that our threshold is going to be higher than 25% because we have a 25% forced rate, guessing rate, that she could get right because she had 1 out of 4 chances that she could guess the right. So we then, between these two numbers, our 25% and our 100% are able to determine our threshold, and we determined it to be around 66%.
Since we're using the 4 alternative forced choice test, we know that Stephanie has about a 25% chance, a guessing rate. So we can go ahead and look on the graph at 25, which corresponds with about 300. So using that, we can plug in the 300 into our disparity equation and discover that Stephanie has a chance performance of about 2.86 arc seconds. So the threshold, on the other hand, which it corresponds to around 62, would result in about 180 test distance. So that threshold is plugged into the disparity equation equals about 7.95 arc seconds. So Stephanie usually gets 20 arc seconds, so her performance would be better than we expected using the Frisbee stereo test.